Good morning. Steve Stites here, Chief Medical Officer of the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. I'm joined on my right by the ever-reliable and ever faithful Hawkeye, and my left by Lauren Lucht. Lauren is one of our outstanding leaders here in the field of psychiatry and psychology. We're going to turn to her in a moment, but first, Hawkeye, how are we doing today?
Yeah, hi. The numbers aren't too bad today, under 30. I think under 30 is a good number.
Okay, you're smiling.
Yeah, it's better than 34, 37 or more. So certainly we have 27 active inpatients right now, 8 of those in the ICU and 7 of those on the ventilator. We still do have 35 other patients who we are considering in that recovery phase from that active infection that are in the hospital though. And then in Hays, there are 19 total patients, 17 active that they are managing, and then 2 in that recovery phase. So still pretty high numbers for Hays.
They're still busy. Yeah, they really are. So let's start off with reporters and see if there's any questions before we delve into some topic this morning.
I don't hear any on the line, but they can speak up after I share these questions with you that were emailed to me this morning. We have 4 questions from media. 41 wants to know, first, differences between COVID and flu-like symptoms. How does someone know which they have?
Well, that's like a really hard question, Dana, because I'm not sure you really can know, honestly. What do you think?
I think that's correct. You know, certainly between influenza and other respiratory viruses, there are maybe some signals of differences, such as really bad body aches, the high fevers. I don't think that you can really discern that and discriminate between influenza and COVID in those instances. There's going to be a lot of overlap in those symptoms. Luckily, right now in the United States and locally, there's a very low incidence of influenza, so that helps. So I think moving forward, until we get more data about increasing influenza rates, I think we have to assume COVID until we get tested and the PCR is negative, and then move on from there.
So did you ever get the CDC map to load correctly? Did it ever restart on their new flu surveillance?
I looked yesterday, the day before. I looked at the maps and the graphs, and there was, so they actually did update it, but it had been several weeks since they had updated it.
It's been a while. That's been a little funky there. So okay, so we're saying it's hard to tell the difference, so you got to get tested. I think that's the answer.
Second question from 41 is, then how are doctors and hospitals preparing for both flu and COVID patients?
Yeah, that's also a great question. Here's the answer. The answer is that in preparing for one, you really prepare for both. Because the truth is, the things we do to prepare for COVID or influenza protect us both ways, because it's all about infection control. Remember, the principles of infection control, what do? They travel with you wherever you go. And so the ability to do things like wear a mask, wash your hands, keep your distance, don't come into work if you're sick, those are the same things we'd say whether you have influenza or whether you have COVID. Now, a second follow-up question may be, how do you prepare if you have a whole lot of patients? Because let's say we have a really bad influenza year on top of a bad COVID outbreak. You know what? We will just do our very best to take care of patients, and that's what we do. We don't want to limit surgeries again, because it's been demonstrated, and actually there's an article out today that I read about it in the Wall Street Journal. It's being published, that talks about the medical data which does show that the breast cancer rates are up, mortality's up, all because people delayed care. We don't want people to delay care. That's a bad outcome. So what we try to do is be ready with bed management and things like that in case there is an outbreak. Here's how you can help us. To all of our audience, to all of our friends, to everyone you know out there, if you follow the principles of infection control and get your flu shot, you can stay safe. And that's what we need everybody to do, because that's what will keep hospitals open and able to take care of people who are sick with all types of illnesses.
All right. Savannah with KCTV5 wants to know, what are the activities that you consider high risk that people should avoid with Halloween?
Well, high risk, I think we know those. We say them a lot.
Yeah.
It's anytime you're going to gather together, especially inside, without a mask and not socially distancing with people who are sick. Those are the wrong things to do, right? And so the corollary is the opposite. The things that you need to do are, you could go do Halloween, but keep your distance, wear a mask, make sure you stay safe, and if you go up to people's doors and they come out, try to stay apart a little bit. Maybe they can pitch that candy at your bucket hot.
Yeah, absolutely. We know that the CDC in their guidance has said that trick-or-treating in the traditional sense is high risk. I think the main reason for that is the groups that are going trick-or-treating together. We have discussed this before. The interaction between somebody at the door giving candy and a child trick-or-treating is extremely short time period. You would think most people would have masks on at that point too, but I think it's really the group setting that is really going to be the danger.
Yeah, so I think that's key. And those Halloween parties are probably the biggest threats.
Yeah.
We used to always have, my wife loved having this neighborhood party for Halloween when our kids were younger. And everyone would come over, we'd have chili and all sorts of stuff. And I think the dads would often take the kids out. And usually Halloween, for whatever reason, is always cold and wet, right? Isn't that always true? And it feels that way. And so the dads would take the kids out with flashlights and things like that, and everybody would be kind of huddled together. Probably the wrong idea this Halloween.
Yeah.
It'll get better. We'll get back to normal.
And we might also let people know that on Friday, October 30th, we're going to have Hunter and Scout, the Poison Patrol puppets, if
Poison
the
Patrol, that's
parents
right.
want to share this with their kiddos. I heard yesterday when I talked with Mesner Puppets that Hunter and Scout have got a lot of questions for you and Dr. Hawkeye.
Ooh, man,
right.
we better go get read up
Yeah.
if Hunter and Scout are going
I
to be
know.
coming to quiz
We gotta
us,
get
brother.
a big brain now. Okay.
Right.
All
Okay,
right,
and
that'll
then
be fun.
KCTV5 has one more question. They say that seems to be a proliferation of drive-up testing at big chain stores. And they're offering this testing that people do the sample themselves, and then they will text them the result in 20 to 40 minutes. They want to know, how can that be a good test?
Okay, Hawkeye, what do you think? I'm thinking, I don't know.
I think any time you are deviating from the gold standard, which right now the gold standard is the nasopharyngeal or NP swab, and it is done by trained healthcare workers. So we have, number one, the test. I don't know what test it is. It's probably an antigen test,
that's an
which is a little bit less sensitive. But does that mean it's less sensitive because you don't have enough viral copies to make that test positive? Or is it because of the operator? And by the operator, I mean the person doing the test. Is it a trained healthcare worker, or is it yourself who's doing it? Where exactly are you taking the sample from? There are a lot of variables there. But again, I would say it's probably less sensitive and less accurate than the gold standard that we're using. Without knowing further details, I would say, just continue to be cautious. This could play into the thought and the theory of testing more frequently and having access to those tests more frequently, say every day or every other day, when you can catch it if you are infectious. But I think it's so new that we just don't know. What I would say is it's probably less accurate than the gold standard.
Yeah, I think I'm with you. Every time you introduce a variable into something, you don't really know how good it is. Those 20, 40-minute tests are almost always antigen tests.
Yeah.
They may mean something if they're positive. The problem is they don't mean a lot if they're negative.
Yeah.
And that's where you struggle. And then you have to try and go out, if you really want to know, because if it's negative, it doesn't mean you don't have the virus. If it's positive, it probably means you do.
Yeah.
But if it's negative, it doesn't mean anything. So I'm not sure how much it's going to help you necessarily. It certainly can't really help manage sick people. I think the other thing is that when you give somebody the opportunity to stick something in their nose and you're hoping they do a good job of it, you have to be a little nervous about how good they're really doing. And the last thing I'd say is, to follow up on your point, if we can get to routine spit testing with rapid results, then I think we're going to have something we can live with.
And we just have another media question that came in from Channel 9. They want to know, what do you do if family members are planning to fly in for Thanksgiving?
Yeah, this Thanksgiving thing is going to get bigger and bigger, right? We've said you can reduce the risk of flying if you wear a really high quality mask. I prefer an N95, but if that's not available, then high quality mask, goggles, wipe down the area around you, and try flying. I think flying on an airline where the middle seats are open, as opposed to trying to fill the whole darn plane. And what we know is that the flow dynamics of an airplane clearly increase the risk for COVID. That is now well demonstrated. The next thing I would just say is, because the aerodynamic of most flights is that the air comes sucking to the floor, when people cough and they start to bring it'll pull down. So make sure you're not touching a lot of surfaces. If you do, wipe your hands and try and keep things as clean as around you as possible, I think, are the important things to fly. But the truth is, you can't, it does introduce more risk. It just does. And you have to just be ready to say, I'm going to introduce more risk into my bubble for Thanksgiving, and that's okay. And if it's not okay to you, or if you have health conditions that make you very wary of that, then having somebody in who's flying in is a risk, Hawk.
Yeah, and I would start even before that, say 14 days before that if you can, for the travelers and the people that they're coming to, and that's try and quarantine at home and isolate. I'll say quarantine at home as much as possible, so you are reducing your risk of exposure prior to travel, prior to going to your destination. If you can do that, the other thing is if it's available, maybe even get tested 24 or 48 hours before you travel. It's going to be important to make sure that the airline has mandatory masking rules, because we know from the hairstylist morbidity mortality weekly report, when both parties are wearing masks, that you cut down on transmission as much as possible. So masking by everybody in the plane is going to help. And although in the hairstyling, in those reports, obviously you're probably with that person 20 to 30 minutes, whereas an airline, you're probably an hour, 2 hours, 3 hours. So you are in that area much longer than that situation. But I would start beforehand if you can. Quarantine, say 12 days, 14 days before you travel. You can consider getting a test prior to travel, and then once you get there, or once you're traveling, do all those things that you talked about, and that will hopefully reduce your risk as much as possible.
Okay, so I got a quick little story to tell. So here we go. So do you know tennis scoring? Love means you didn't score, right?
Mm-hmm.
The key on that hairstylist story is it's 140 love. Why 140 love? Because 140 clients were with those hairstylists while the hairstylists were positive, and everybody had a mask, and nobody got sick. Nobody got COVID. 140 love. Important message there. All right, Lauren, talking about masks. This is kind of some background. You and I were talking a little bit before we started. You're our executive director for mental and behavioral health here at KU. You yourself are a licensed therapist. Mm-hmm. You also administer an entirely very large operation for us. You work at a couple of our psychiatric hospitals. You help run those. I mean, you've got quite the background here. And so today, you're going to help us understand, why won't some people wear a mask?
I think there's a couple issues going on. I think one, it's inconvenient. We don't like to be inconvenienced. We just don't like it. The other piece is wearing a mask admits that we're vulnerable. We don't like to feel vulnerable either. So one of our defense mechanisms as humans is to convince ourselves that bad things don't happen to good people. In psychology, we call that belief in a just world. So if I'm a good person, good things will happen to me.
Wait, do you mean that bad things do happen? That this is not a completely just world?
It is not a just world, and I think we have to accept that. So being a good person does not at all correlate with your risk of contracting COVID-19. And so I think we're in a bit of denial. And we don't want to be inconvenienced for something we want to believe we're at extremely low risk for catching and transmitting.
So you and I were talking a little bit about before the program, because I was commenting about how well the prisons had done, and you pointed out to me, well, yeah, the prisoners are doing a great job, but sometimes the staff aren't doing as well. Tell me, why is that? What's going on with that?
I think that especially in sort of military ranking type systems, we have this feeling of invincibility, and we want to believe that they can. They've made it through amazing things. They in a correctional environment, you absolutely do live through sort of pandemic like experiences on a regular basis, and they always make it through. And this is really different. A pandemic is not normal. And so we can't pretend like it's just another normal obstacle that if we just tough it out, we'll make it through. We have to follow the pillars of infection control prevention and make sure that we are wearing our masks, washing our hands, and keeping distance when we can.
And so in our psychiatric facilities, are people doing that, you think? Are we doing a good job?
We've seen a huge improvement. So prior to the governor's order for masking, we were having a really difficult time at our child psychiatric hospital because it wasn't normal to them. Why all of a sudden, when I didn't have to wear it to go into Quick Trip, all of a sudden I'm in a hospital and people are telling me that I have to wear a mask? But once it became part of normal life, kids are resilient and they follow rules. And so we've just seen a tremendous uptick in mask adherence and mask compliance in both our adult and child facilities. Our staff are doing an excellent job. We have PPE spotters everywhere, making sure that everyone is compliant. And we've managed to make sure that we've had no patient-to-patient transmission at either of our psychiatric hospitals, something to be really proud of.
It is something to be really proud of, and a great thing for our community. So thank you for that great work you're doing. So tell us a little bit, though, how busy is your team? I know that mental health is a big concern in this crisis. Is your team pretty busy?
It is really busy. So back to that vulnerability piece, right? We don't want to feel vulnerable, so we may justify to ourselves that the inconvenience and the risk of personally feeling vulnerable is just, my risk is low, so I'm going to be okay. That belief that everything's going to be okay. Well, there's the flip side to that, right? What about when I am feeling vulnerable and that's not something I'm used to feeling every single day? And so that adds to the stress level that people are experiencing. And we've certainly seen an uptick in both our ambulatory requests for services as well as our inpatient admissions. People are struggling. This isn't normal.
No, it's
and
not.
there really was never such a thing as normal, but this is so far from what we're used to.
Yeah.
The people are just, it's hard. 30% of Americans are reporting an increase in depression and anxiety related to the pandemic, and other experts would argue that the other 70% are lying. I mean, it is impossible to, I don't know what island you might live in where this wouldn't have inconvenienced an element of your life that becomes a stressor. And so the longer it goes on, we're seeing people experiencing just fatigue with dealing with all of these inconveniences, this perception of vulnerability. And then I think in the farthest end of the spectrum, fear that what if I'm a vector, right? What if I'm positive and I don't know it and I've spread it to people I love? And so that would be my plea for the community is even if you're invincible, and teenagers, some people in their age group absolutely experience, this sense of invincibility. We're supposed to grow out of that and realize that we are actually human and bad things can happen to us and we can, in fact, get sick. But remember that even if you're Superman and even if you're invincible, the people that you care and love around you are not. And even if it saved just one life, please wear your mask and keep your distance and wash your hands.
It's the best. So now, here's my big question for you. This is the hardest one of the day.
All right.
All right, here we go. So, I have a high cholesterol. And now here in the midst of this pandemic, I've started eating fried chicken and Lay's potato chips. And I ain't talking the baked stuff. I mean the good stuff, right?
Right.
Once again, it's back in my life as comfort foods. Am I allowed to do that, Lauren?
I think you should give yourself some grace.
Outstanding. That's what I like to hear. You can come back on the show anytime.
I would like to, just talk about the mask. There are other details about why people don't want to wear a mask. Certainly, I think it's been really prevalent in the Asian culture for some time now. So they are not like us. The other thing is it has become, for some reason, an analogy or metaphor for our personal individual freedoms, which it shouldn't be that as well. And so I think there are many aspects, just like you talked about.
Yeah, and I think that question is, freedom has always been with responsibility. Yes. There was never absolute freedom in this country. That is a misbelief. It's always been, whether you go back to the 1700s or beyond, and if you read American history, it was always freedom with responsibility. The question is, what is that level of responsibility? You can't drive into a building, you can't drive into a crowd, you can't catch a building on fire, you can't kill people randomly. You see, that's why it's freedom with responsibility. You can't just do totally what you want.
Absolutely. We have to be responsible because we don't want this to stay forever.
No, I'd prefer it go away really soon, actually.
I would too.
I'm all about that.
And if wearing my mask makes that happen, I'm all in.
Yeah, let's do it. And, I think I look good in mask. There you go. Let's see what questions we have out there, Jill.
Yeah, they're kind of all over the board today, which is great. Gretchen wants to know, do you think that they should wear goggles in places like grocery stores now that the COVID is...
Yeah, there is more COVID out there. You can feel it. Someone yesterday described it, it's creeping in around us, and I think that's true. It's just, there's more of it. It's a little more prevalent. The spread's increasing. We see that in the United States. We see that in Kansas and Missouri, and we see it locally. So should you wear goggles in a grocery store? And, I got to tell you, sometimes I do and sometimes I don't.
Yeah, I always advocate for that. I don't wear it in that setting. But I think, especially if you're a worker in those settings, or really any work settings, I think where when I'm just walking around the halls, when I'm seeing patients, I have my goggles on. So we would always endorse that. Certainly, we do for traveling, especially air travel as well. I don't think it's a bad idea at all.
I tend to go to the grocery store when I know there aren't a lot of people there, like at 8 a.m. on a Sunday morning or a Saturday morning. It's not very crowded, and I kind of get in and get out and stay away from the crowds. And I think that's another strategy to help reduce the risk around that. I think the other part of that answer is if you are a higher risk person, that is, you're more concerned about the possibility of how COVID will affect you, everything you can do to stay safe helps you. And so in that situation, I think wearing goggles makes sense.
Georgianne has a question that probably would be good for you, Lauren. She says the cold weather, she doesn't mind it, she likes it, but what she doesn't like is that with the shorter days, she's not going to be able to walk through her neighborhood and wave to neighbors, which is what she's been doing. And she said, how am I going to have human contact during the winter?
That's a great question.
That is a great question. And it goes back again to creativity. It may not be convenient. It may not be ideal. But there are ways to stay connected. And so whether that is sending an email and saying hello, having a neighborhood Facebook group where you can post little videos to people and say hello, we just have to be really creative right now because we don't want this to stick around forever.
Yeah, my answer is campfire. As things get a little chillier outside, there's nothing like sitting around a campfire. And they say, well, you can't have a campfire in every yard. That's true, but they have those little fire pits that you can get down at the hardware store. They're not that expensive, and you put the wood in, and they say, okay, let's have a little fire going. Chip in with a couple of your neighbors. You all get it together and say, okay, Friday night campfire, let's go. And I think that you can even actually roast marshmallows and things like that.
You can. I have seen my neighbors set up in their own driveways, little fire pits.
That's what I'm talking about.
Everyone's sitting at their own driveway, but there's unity in seeing the fires down your street and being able to. We can still yell in the dark. They may not be able to see us wave, but we can still yell hello.
You could even put 2 fire pits in a driveway, more than let's say 10 or 12 feet apart, and you guys can talk to each other. That's safe. You're outside. If you just got to think about this differently and say, okay, I'm not going to let it beat me. I'm going to have a little fun with this.
Yes.
So what can we do? And my answer is, well, we're going to have a campfire.
We did have a question about hay rides. I can't find the person who did it, but
Don't
when you
light
said
the hay on fire.
campfire,
That's a bad idea.
Yeah.
No hay fires. Those are bad.
hay rides.
No, hay fires. Don't light
No.
the fire.
Don't have a fire.
No, I'm just
Yeah,
saying.
we know that. That's not the question, but thank you. The question is, how do you feel about hay rides? Because that's kind of a popular thing to do right now.
Just if you're close and you're sitting together in a wagon, there's a lot of people. That's a bad idea.
Yeah.
It's it's funny. The pillars of infection control travel with you wherever you go, whatever you do, and those things that you want to do because it's what you've always done that make you feel good about Halloween or going to pick apples or taking a sleigh ride out to go try to find Christmas trees or whatever. You still got to follow the pillars, Hawk. And what it means is that if you're in a close congregated situation, and especially without a mask, even when you're outside, that could be a super spreader event.
Yeah, definitely. Wear masks. All parties should be wearing masks. I think that industry has really taken steps as well, as we've seen most of these industries have changed. But also, if you can separate from other people who are not in your bubble, other family members that if they're not your family members who you live with, things like that. It's just continued separation, distance, masking, things of that nature.
Makes a difference.
Isaac wants to know, he read a study out of Australia that said the virus could live on some surfaces for 4 weeks.
Yeah.
Yeah, I saw that study too.
I
But
read through
the risk of transmission dies down because the viral part of it doesn't take just one.
Yeah.
You got to get a better concentration and a stronger inoculum of virus than that, I think. Huh?
Yeah, that it's the one that there was another one I saw also from Japan. Also, we certainly can live in there, but what is the concentration? The concentration they're actually able to pick up was an extremely small. I think it was, 1 log, or so that's about 10 viral particles. So the concentration goes down, the viability of that virus goes down. That was done, or most of these studies are done in pristine laboratory conditions as well, not in the typical real-world environment. We know that on the human skin, it can live for approximately 9 hours based on this small study. But the important thing to note is that hand hygiene is important because about 15 seconds after you do the alcohol gel or alcohol spray, that virus isn't activated or killed at that point. So that's the important thing to know. That just goes more to the point of, we certainly know it can live on surfaces. Fomites are inanimate objects. It's not the main way it's spread, but it certainly is a risk. But certainly more importantly is group gatherings together, person-to-person spread, things of that nature. And that just reinforces more, do adequate, frequent hand hygiene with hand washing, with soap and water, or with the alcohol.
It's all about the breath cloud.
Yep.
It is all about the breath cloud.
Annette came from Portland 2 weeks ago to visit her son, and she's been sleeping in the car. But she said it's getting cold now. Is it safe for her to go inside in any way, or are hotels safe?
Okay, sleeping in the car for 2 weeks sounds like a really bad idea. I think if it's been 2 weeks, go inside. You're very safe. And I think if you're feeling okay prior to that, and you can maintain separation in the household or wear a mask even in the household, you were safe to go inside. So I wouldn't be too concerned about it. I mean,
No.
first of all, I'd be concerned about mental health sleeping in the car. What do you
Yeah, I don't feel like that would be the best for our mental wellness to do that. You know, you don't want to torture yourself to be compliant either. There's a
Yeah.
way to do both.
think? Yeah.
No.
And don't you think they
Yeah,
can
no,
get inside
absolutely.
safely?
I think going inside or going to a hotel would be safe. I think more for the physical aspects of sleeping in the car and the mental health aspects are much more important.
And I would just say that I think hotels can be safe, but it's the same rules. It's not, you're not going to gather around a lot of people. I've traveled, you've traveled. I don't know if you've traveled so far since the pandemic, but hotels can be safe if you do it right and don't go down to a crowded breakfast bar. Bad idea. Don't hang out in the lounge with a lot of people at night. Bad with a bar. Bad idea.
Don't pile in an elevator.
Yeah, thank you. Exactly.
Wash your hands after you
That's
touch
right.
the buttons.
If you go into the exercise room and 6 other people are in there and it's a small room, don't do that. Bad idea. But if you can get into the room, take a walk outside, get the food and eat in your room, you can be really safe at a hotel. And I think that's really, that's important.
Loretta has some anxiety over this whole pandemic. She said, will it ever calm down? And she said, will it ever go away? Will we just keep having to wear a mask and be fearful that we're reinfecting?
Yeah, you bet. That's also a great question. Hey, the pandemic is going to go away. And we're gonna address that. First, let's talk a little bit about the mental health aspect of that. Anxiety is hard right now.
Anxiety is hard, and I do think that's a huge piece of it. That will this ever go away? And if not, how inconvenienced am I willing to make myself right now for something that I don't see an end or a light at the end of the tunnel? And you just have to remind yourself that all of the things we've been talking about every day, the pillars of infection control, will make this pandemic go away. It will get better, and we will be able to resume many aspects of our normal life. And we just have to focus and remember on that. So a little bit of inconvenience right now, maybe a lot of inconvenience now, will pay off in the future.
Yeah, it does make a difference. And Hawk, I think even today in the New England Journal, or yesterday in the day, are articles, New England Journal of Medicine, there are articles about even new vaccines and new approaches to therapy, in addition to the ones that are already in phase 3 trials. We're going to get to the vaccination sooner, I think, rather than later. And the monoclonal antibody therapy, at least the one from Regeneron, looks pretty darn good. I know the Eli Lilly one's on pause right now, mostly from, I think, with combination therapies with other things. I still believe, opening day, I think we'll have some fans back in Royal Stadium. Talk to us about that.
Yeah, it's certainly going to get better. We know that there's so many resources, private industry, government resources, the smartest minds in the world going towards getting a vaccine or other therapies. It will certainly change. It won't be as it is now. It may not initially get back to 2019, but we are working towards that, and we are going to have those to use, vaccines, therapeutics. Masks may be around, though, for a while. Certainly, I think in the healthcare system, masks are going to be around without any end in sight for that. Things will be different, but it won't always be the same, exactly the same as it is right now. We would want to gather, hopefully, and I think we can get to some point where we'll be able to do that.
And I think that we will. Plus, the virus itself has its own independent course that can easily lead to mutations or changes in the virus, and so we know that that can happen. It certainly happened with SARS, that COVID-1, and if we have vaccination, there are fewer people for SARS-CoV-2 to spread to, then there's a much stronger likelihood that it will begin to die out. And so I think that that's really, in the long run, that's going to be our best hope. In the short run, it's going to be vaccination, wearing a mask, following the pillars, and getting monoclonal antibody therapies and other antiviral therapies out there that will help us. But in the long run, it's all about vaccination and then having enough herd immunity. The virus doesn't have anybody to spread to, in which case the viruses tend to die out at that point. So I don't think this is a forever story. I really don't. I tell you, I want to be back at Arrowhead. I think the Chiefs need a little more fan in that stadium. I think we beat the Raiders if we have 75,000 people going full throttle at Arrowhead. And that's what we need to do. We want to get back to that life, and I really am confident we will. It's just we do the pillars now in order to get back to there, and or as Hawkeye said, to get forward to there. I think that's important.
Donnie wants to know if you can speak to the anger that people have in their claims that this is about trying to take away my freedom if you make me wear a mask.
Yeah, you bet. Okay, Lauren, I'm going to start with you before I go off on my own little exposition there.
Well, I look forward to your explanation.
Yeah, I don't
But-
know.
Again, we miss things. We miss weddings and hugs and smiles and high fives and handshaking, and all of those things are completely valid. We can't do those things right now the way we used to do, and it's about personal responsibility. It's not about taking away anyone's freedoms. It's about being responsible so that we can get back to the life we had before, where we could do more of those things and have more control about whether or not we put a mask on or not. Right now, we have to band together as a community and wear our masks so we can get back to the things that we love and miss so much.
What do you think, Hawk?
Yeah, I agree. I think there's enough objective data and science out there that shows that mask wearing and separation or physical distancing works to decrease the spread of this virus. That then works to decrease infections of people that we love, although we have always said, 80-85% of people never have to seek medical care. When you have so many people infected, and those people can be your loved ones or your friends, it does cause a lot of devastation. That continued thought of, I don't have to wear a mask because it infringes on my freedoms is really certainly a backward thought. It's not based in any science or data, and really needs to, we need to change. I think it is changing more and more, but we still have a lot to do as far as a full mask culture in the United States.
Yeah, I'm pissed and I'm angry and I don't want to wear a mask. Well, I get it. I don't want to wear a mask.
I don't want to
either.
wear a mask.
Right.
I go out into some parts of southern Missouri where I go camping a lot or fishing, and not a lot of masks going on. There's a whole lot of COVID going on now. And I think what we have to remember is that we can't let anger and resentment beat love. And the way we take care of our communities till we are out of this is to follow the pillars. And following the pillars isn't a sign of obedience. I know a lot of people don't want to be obedient, and so they lash out at that. Following the pillars is not an act of obedience. It's an act of love and generosity. So on one side, you're going to have anger and denial, and you're just going to be pissed. And I get that, because there are days I'm like that, and there are days I'm like that when I see people not wearing masks. Wearing a mask is an act of kindness and generosity to everyone else. It protects you, but it really protects everybody around you. So it's really an act of love. So, can love trump hate? I think it can. And I think that's how we have to look at this equation. And the science is here to help us get to the other side. But it's our own individual actions that drive our ability to do that. And if we all take an action based out of anger, where does that land us? It lands us in the ICU. Bad place to be. Whereas if we do the right thing and try to wear a mask and take care of each other, where does that land us? Well, I think it's going to land us back at Arrowhead Stadium. And you know what? I'm going to be pissed at the Raiders. So let's go, Kansas City. Wear a mask. Love beats hate. Let's go.
It's almost a good place to end the show, but or the update rather. But we have a few more questions. You tell me when, because I know you guys have got to do things. Debbie wants to know. She said, "I thought I heard Dr. Norman say we are starting a third wave of COVID. Is that true? What does that mean?"
Yeah, it's one of those things. If you think about the ocean, you watch it, the wave comes in, sometimes it's a big wave, sometimes it's a small wave, sometimes it's a little flat, and sometimes it's a big crashing wave. And that's kind of how I'm looking at the COVID thing. It's never really gone away. It just gets better. And that's all based upon the events of society. And really, there's about a 6 or 8 week lag for whatever happened in society to seeing this thing spread a lot. And I think what happens is there was the initial wave when we were all kind of not really caught off guard, but we weren't sure how to react. And then there was after Memorial Day when things kind of opened up in society, people said, "I'm back." I'm like, "Well, wait a minute, so is COVID." And then schools reopened, and we had Labor Day, and now we're seeing the effects of that. I don't think any of that should be unexpected. The question is, how do we respond to it? This is also a follow-up on Love Trump's hate. If you go to Douglas County and Lawrence, University of Kansas, they have knocked it out of the darn park. Now, you don't get cocky because you're doing good, but you're doing good. And it's an example of where the community, the city, the health department, the university, and all of us work together to keep that place safe. And they have done one of the best jobs in the country. And that school is open and it's going. See, you can do this right. And they have 5 patients in hospital beds with COVID at Lawrence Memorial Hospital. That's not a big number. Now, you go to other communities that are overwhelmed by COVID. Why is that? Because they didn't treat it the same. Love Trump's hate.
Yeah, and I think we also have to be aware of the local dynamics of the infection. We were not what New York was when New York was getting hit so hard. So I think more than waves, I think if you can Google a picture of the Big Bang, you'll see this part of the Big Bang called inflation or expansion, and that's just as the universe is moving outward. That's really what this is, and this virus is spreading from these certain metro areas to a majority of the larger metro areas, and now it's hitting those rural areas, and it's just continuing to spread through the country to those areas that didn't think they had it, didn't think they could get it, and now we are seeing these rural areas get it as well. In addition, locally in the metro areas, we are also seeing increased cases overall as well. So it's just continuing to spread. We can use just different words, waves or surges or anything like that, but the overall really point to take is that it is just continuing to be out there to spread because there are still vulnerable people out there. There are gatherings, there is no masking. All of those things contribute to this.
Last question.
Okay, and I want to tell Sue, Debbie, Vicki, Barbara, Stephen, and Terry, great questions. I will have them on tomorrow. Matt, it gets the last question tonight. He wants to know if you could look into your crystal ball. What will society and the pandemic look like 1 year from this month today? What are you forecasting?
All right, let's see. What do you think, Lauren?
Crystal balls are
Notoriously
I would
difficult.
really love to have one
Right.
and a magic wand to go with it. I think it's in our hands if we follow the pillars of infection control that we've been talking about every single day. I think it's going to look dramatically better. I think if we pretend like we're invincible and that we treat it like it's just a virus, just another virus. I want to remind people AIDS was just a virus. Hepatitis C was just a virus. Just because it's just a virus doesn't mean we shouldn't take it seriously. And it's how we protect ourselves and what type of universal precautions we use going forward. That's going to determine where we're at next October. So let's, again, go to love, do it for each other, and so we can have a better October next year.
What do you think, Hot?
Yeah, I think it will look different. I think there, will hopefully be other things, especially coming up in the next year. We're looking at, maybe concerts getting to the K, more people at Arrowhead, but it will be a little bit different than it was in 2019. But I think it'll be, quite different from how it was this October as well. I think for the better, because we will have those other things in place, systems for outpatient therapies, vaccination, things of that nature. I think overall it will be better, but we still have to wait to get to those steps, and everybody is working towards getting to those things.
Yeah, my crystal ball is foggy at best, but I'm going to take it on. It's going to be a lot better, I think. I really do. I think we will have people back at the K. I think Arrowhead, I don't know if it'll be 75,000 people, but I bet it's got a lot more in it. I think a lot of things are going to help us get there. I think you're going to be able to wake up in the morning and do your antigen check at home or your COVID test at home and know if you got it or not. And if you're positive, then you go out. And I think that's going to be a game changer. I think antibody therapy is going to be a game changer. I think antiviral therapy directed specifically at this is going to be a game changer. I think vaccine will be out by then. And it's going to be a game changer. All of these things say it'll be a lot better than it is today. Don't know exactly if it'll be all the way back to normal. Probably not. But I think on a scale, we'll be way over half better. And I think that that's what we have to look forward to. You know, I'm kind of an optimist that tried to be an optimist, but I think that that's right. I think we have to find hope. And we can find hope in a lot of places. And one of the places I find hope is when I see a lot of kids wearing masks. I see a lot of people wearing masks because they're going to be kept safe and they're trying to keep everybody else safe. And that means next October, we're going to go trick-or-treating. And we're going to do it together, or we're going to have some folks in the neighborhood. And we're going to be out at Arrowhead Stadium. So until then, what can you do to stay safe? Same things we always tell you. The pillars of infection control go with you wherever you go. And sometimes the best thing is still to hang out right there in your house and just remember, there's still no place like home. Hey, tomorrow we're going to have another great program. We'll be answering your questions. Amanda Gartner, the Director of Infection Prevention and Control, will be joining us. Here's a picture coming up of Sarah, who's a 7-year breast cancer survivor who supports masking, the Chiefs, and breast cancer awareness. You rock that, Sarah. Well done. Thanks for showing us that. That's awesome. Remember, love trumps hate. We're here tomorrow.